Today, lip filler. Does it have to end up looking like a sausage, or is that optional? Okay guys, I'm here today to talk to you about lip filler. I get all kinds of requests in the clinic, mainly from people who want to have a little bit of something done, but they don't want to wind up looking overfilled, thinking sort of Kylie Jenner or Nicole Kidman in that particularly awkward period. Someone like Angelina Jolie has got a really full pair of lips, but the anatomy of the lip has been well respected, so it hasn't just ended up like a big overstuffed sausage. And what about more under the radar celebrities like Ellie Goulding, for example, who's also recently being spotted with maybe just a touch of extra jazz in the lip? So how do we make sure that we are ending up with something that looks really, really natural and isn't stiff and doesn't look like just a couple of worms on a plate? Well, it all depends on how the product is put into the lip and really what you've started with in the first place. So it used to be that back in the day, we would just inject a whole bunch of product directly into maybe the body of the lip right here, or just around the edge of the lip, the vermilion border. But techniques have really changed since then, and products have really changed as well. So if you did want something that is barely undetectable, you can have that. If you want something which is more of a fuller look, you can have that too. It's my preference to try and steer away from things that maybe don't look so anatomically correct, but hey, if that's your preference, go for it. I always use a hyaluronic acid filler in the lip, and the reason for that is for safety. So you know, with a hyaluronic acid filler, you can dissolve it if there's a problem with it. So if you wind up getting a little bump, or if, God forbid, there's some kind of vascular problem, you just inject an enzyme and the filler's gone. Even if you don't like it, it's gone, boom, away. You can't do that with the semi-permanent or permanent options. Like, I don't know if you remember, but maybe 5 to 10 years ago, a lot of people were having lip implants placed, and obviously the issue with that is once it's in there, you can't just inject an enzyme and get it out if you didn't like it. Let's just have a look at a couple that I've done for the channel. This patient came in having had her lips augmented previously, probably about 6 weeks ago, and we didn't really like the shape, so we decided we were going to dissolve it. She had a great shape anyway, so we just injected an enzyme in there, and you can see it's pretty much gone afterwards. Men sometimes have lip filler done too. I didn't particularly like the look of his, so we again dissolved the old filler, and you can see here's the filler all gone. We then added some more because he wanted to have a little bit more of a pout, so we went ahead and refilled the area. In terms of methods to augment the lip, there are loads out there. So most people will use just a needle. They'll put the needle in the lip and then inject the filler as they're coming out. And the common areas to do that will be the vermilion border, which is around the outside of the lip, or sometimes they'll inject directly into the body of the lip. You may even have seen a technique called lip tenting, which is where the injections are placed straight down like this and injected as they're coming out. Let me show you some examples of how I like to do it. So first of all, this is me using a cannula. Now, it looks really weird when you use a cannula in the lip. It looks like it would be super painful, but actually, if you inject the product you're going in, the filler will push out of the way the tissues, and it really takes the edge off the whole thing. I never use any cream, or that's topical anesthetic cream, or injections when I'm doing lip fillers. I just do it all plain without. So it really depends on how the filler is done as to whether or not it's particularly painful or not. Let's go and have a look at a patient who's had lip augmentation done with a cannula. You would really use cannula when you're trying to make the lip a little bit wider. So this is particularly useful in the upper lip. You don't have to do it on both sides. If someone's got a lot of asymmetry in the lip, you can just add product on one side where you're trying to lift it up slightly. But using cannula is suitable for both the bottom and the top lip. The next thing that I'd like to show you is microdoses. So this is where I swap out the needle and I use a really, really tiny little needle all the way along the border of the lip in little tiny boluses of product. And the point of this is so that we can flip open the lip a little bit more. The reason that I like this particular technique is because it gives you a really, really natural result, and it helps to preserve the anatomy of the lip as it was before you had the filler done. So no sausage looks here. You can also use this technique to augment what's called the Glauco-Klein point, which is the very, very top bit of the Cupid's bow right there on each side, and that looks quite pretty. The classic way of doing a lip augmentation, as I've mentioned, is to inject the vermilion border. On this patient, you can see that I am injecting the vermilion border, but I'm doing it in such a way that I'm not going to inject all the way around the outside of the lip, because that just looks really weird. So we've done the upper part of the vermilion border, and now I'm going to go onto the lower lip and really just emphasize the middle third. That's the important area on a lip. So the middle third of the lip should be the most full part of the whole thing, and it should be in line with the distance in between the eyes. So if you measure this distance here, that should be where the fullest part is of the lower lip, and that's the area that you really want to augment. The width of the mouth should be the phi of this distance in between the eyes. So remember I was telling you about golden ratios in earlier videos? Well, that's it there. If you look at someone's lips, like Angelina Jolie, you can see that she's got what we call tubercles in the lip. These are naturally more full sections. So you'll have two on the lower lip, here and here, and then there's one in the middle right there. And that's how you can keep a lip looking much more natural. So when we're doing a lip augmentation, it's really important that on some people, we maintain those tubercles. You can see that here, I'm injecting into the tubercle in the upper lip, vertically straight down. Actually, this is quite interesting because if you've seen some videos on lip tenting, which is where somebody will go vertically into the lip from the outside, the problem with that is you don't know where the artery is inside the lip, so you're just kind of guessing. It's much safer if, when you're doing this, you inject all the way through to just inside the lip here. I know that sounds mad, but what I like to do is I put my finger here and then inject down like that, and then I like to just feel where the outline of the needle is, and then you know that there's no blood vessel between the needle and the skin. So it's much safer to do it that way rather than just blindly injecting into the body of the lip. You can also turn up the corner of the lip by injecting the commissure here on both sides, and that's something that we will probably do as standard. When you're looking at a lip injection, it's important to have a look at the whole area. So if somebody doesn't really have very much of a chin, or if their chin is very depressed, or they've got a big line across here, it's normally quite important to treat this whole area first, because the way this looks will inform how the lip looks. Okay, so that's it for this week. Don't forget to let me know in the comment section below whether you've had a lip augmentation done or if you're thinking about having one done. Come back next week for more of the same, and in the meantime, don't forget to like, comment and subscribe.